Hello, called and chosen people. I hope everyone is keeping well. My name is Inkem Okpala. I'm a practicing physician in the state of New Jersey, and I'm coming to you again this week with a very interesting topic. It's called SIBO, which is small intestinal bacterial overgrowth, right? Now, this is a disease or a gut issue that is not typically diagnosed, right? Because most of the time it presents with gut associated disorders. So what does SIBO mean? It just means bacteria, whether good or bad, growing where it shouldn't be growing, right? And it actually causes about 60 to 80% of irritable bowel syndrome. So most patients that have irritable bowel syndrome most of the time have SIBO, right? So SIBO impacts digestion, it affects the pH of the gut. Now remember, the pH of the gut is mostly acidic. Well, different parts of the gut have different pHs, but it's mostly acidic, right? It's associated with gastroesophageal reflux disease, inflammatory bowel disease, autoimmune disease, right? So the hallmark of SIBO is usually digestive clinical features. So someone comes and says, you know what, I feel bloated after meals, especially. They have like IBS clinical features, meaning that any little form of stress and they start presenting with the bloating, nausea, vomiting, right? Sometimes skin issues, because remember, your skin is your largest organ of elimination, and whatever is happening in your gut shows on your skin, right? From your skin, you can determine, what's going on in my gut, right? They present with fungal issues, which could actually present as mental disorders, depression, anxiety, right? Muscle fatigue, reduced stamina, weight gain, and actually be a symptom of small intestinal bacterial overgrowth. Abdominal pain that is not relieved with bowel movement can be a symptom of small intestinal bacterial overgrowth, right? So it's extremely important that when you are on any round of antibiotic, whether for any form of bacterial infection, right, that you're actually using digestive bitters as well as probiotics so that you don't destroy and decimate your gut microbiome. Okay, extremely important. And there's no quick fix when it comes to the gut, right? You want to, whatever you're doing has to be systematic and consistent for you to actually see results. So we've talked about those clinical features. Now, what are the things that SIBO can cause? So once you have SIBO, what are those things that can be exacerbated? So one, gastric acid is reduced. We've spoken about gastric acid in the past and how to bring that up. Same principle here. Hypothyroidism, right? Endometriosis, gastroenteritis, food poisoning, right? And all this can actually lead to autoimmune irritable bowel syndrome. We'll talk about that down the line, okay? Not today, some other time. All right, so these are things that you can actually see in patients with SIBO. Now remember, whenever you're talking about the gut, not everybody presents with gut symptoms. So the gut associated symptoms we're talking about now will be thyroid disorder, mental disorders like depression, anxiety, bipolar disorder, right? Skin issues, right? Muscle fatigue and all that will be considered gut associated disorders. Back pain, you can present with back pain and it's actually SIBO. Okay, so how the heck do I manage SIBO? First of all, testing is important. The testing is not always perfect, but I'm really very big on functional stool analysis because it's kind of like a gateway into the rest of the body, right? I want to find out what is going on in my gut, right? What is pointing towards small intestinal bacterial overgrowth. Now, if you have had a round of or consistent rounds of antibiotic, it doesn't matter whether it was when you were a child or as an adult now, the risk of SIBO is still there. Okay. Then things like berberine, plants, antimicrobials, right, are extremely important. Make sure you're eating the right way. We've discussed that before, right? You want to also make sure that you're doing like what we call a gut sensitive protocol. So make sure you're doing like soups and stews that are rich in plants, okay? For SIBO, no fiber for about 3 to 6 months. It actually makes it worse, right? So we're going to reduce FODMAPs as well, right? You want to make sure that you stay away from FODMAPs if you are diagnosed with SIBO. You're going to reduce fermentable foods, so like, oh, my kombucha, right? Kombucha, kimchi, right? Sauerkraut. You have to cut back on that for about 6 months so your gut heals. Remember, it's very temporary, especially if you start managing this. The fiber, the reduced FODMAPs, reduce fermentable foods, you want to cut back on that just for a period of 3 to 6 months. As your gut heals, and you start to see that, okay, I can start to reintroduce this food. So almost like an elimination form of diet for SIBO for a period of time. Then you can do herbal antimicrobials like caprylic acid, grapeseed extract, right? And you want to make sure that when you eat, you should eat for like before eating, half an hour before a meal, right? You want to make sure you're doing the lemon water, the orange bitters, right? This is to increase gastric acid production. And you want to make sure that you're chewing slowly. So you're not eating and driving, right? You're chewing extremely slowly. You start to see the symptoms of SIBO start to abate. So about 9 months to 1 year from when you do the stool test, whether it's a Zuma test or whatever, right? You want to make, and it's a specialized test. The labs don't do that. Also in this patient's test for H. pylori, because most of the time the patients have Helicobacter pylori, which can be a test that a traditional lab does do. Okay, so that's just a little bit of what you can do for SIBO, the symptoms that you have in SIBO, right? As always, I always recommend that if you're watching this video and we are not your physicians, please follow up with your physician. Do not self-treat or self-manage. If you have any questions, you can go to our website. It's always linked in the comments as well. And also, don't forget to like, subscribe, and share this video with people that are going through a lot and are looking for answers, right? You might just be able to help somebody today. All right. I pray that all goes well with you. I pray that you have a great rest of your day, and I'm going to see you guys soon. All right. God bless you. Bye.